All right, so this is skill 2.30, administering metered dose inhaler medications. So you're going to be helping your patient with their inhaler, okay? All right. So the first thing you're going to do is you're going to check your medication order. You're going to make sure you have a medication order, and then you're going to go to the med room or wherever it is in your facility that they keep the medications, and you are going to get the correct medication. You're going to check the medication label 3 times for safety, okay? You're going to check it and say, when you take it out of the med room or out of the med drawer, and you say, yep, that's it, you're going to make sure that it's not expired, okay? All right. Then you're going to compare it to the MAR, okay? You're going to say, yes, that is the correct medication. Yes, it's the right dose. It's the right route, okay? And then you're going to check it again when you get to the patient's room. 3 times you want to check the medication, okay? 3. All right? Then you're going, whoops, I'm trying to make it so that you can see better. I guess I got to move it further away. There. Okay. Then you're going to perform WIPSA. So you're going to go into your patient's room. You're going to do your WIPSA protocols, okay? And, oh, I didn't tell you what what supplies you would need. I'm sorry. Okay, you would need gloves. You would need your inhaler, and then you'd need this thing called a spacer. And I'll explain to you what we're going to use this spacer for, okay? All right. So, you perform wipes, so you're going to put on gloves because you're going to be dealing with, you know, mucous membranes and spit or whatever. So, let's put some gloves on, okay? All right. So then you're going to educate the client by explaining that the inhaler delivers a metered dose of drug with each push of the medication canister. Okay, so every time that they push down, or they push down on this part right here, this part, push down, every time they do that, it's a metered dose of medication. Okay, so 1 push is 1 dose. All right. You're going to educate the client on the proper use of the metered dose Nebula inhaler as follows, okay? First of all, you're going to ensure that the canister is firmly and fully inserted into the inhaler mouthpiece. This is the Nebula, the inhaler. This is the mouthpiece, okay? You're going to take it, you're going to make sure that it's in there and it's pushed down, okay? All right, it's in there, it's firmly in there. The next thing you're going to do is you're going to remove the mouthpiece cap. That's this part right here. Remove the mouthpiece cap. Now, you're not going to put it down, down on the counter like this. Okay? It's not going down on the counter like this. You want to put it up on the counter like this so that the opening is on the top. Okay? So you set that on the counter. All right? You're going to, holding the inhaler upright, you're going to shake it, the inhaler, vigorously for 3 to 5 seconds. You're going to shake 1, 2, 3, 4, 5. You're going to make sure that that medicine gets really shooken up, okay? All right? Then you're going to, this is called an MDI, multi-dose inhaler, meaning that you can use it multiple times, okay? So you're going to insert the MDI mouthpiece into the spacer. Remember, this is the spacer, okay? All right? So on the spacer, there's this opening down here that looks like the end of the inhaler. Whoops, see it? See how they match? Okay, so you're just going to insert that into the end of the spacer. See how it sits in there? Isn't that nifty? Okay. So you're going to hold the inhaler with the canister on the top. You want to make sure that this is always up, okay? And then you're going to hold the inhaler 2 to 4 centimeters from an open mouth, or put the mouthpiece into the mouth with the opening toward the throat. Well, first of all, you have to remove the cap. There's sometimes a cap on the end. You need to remove that. This is the part that's going to go towards their mouth, or in their mouth if it's their spacer, okay? All right? So what you're going to do is you're going to tell them to put their mouth around the this part right here. I'm not going to do it because it's not mine. Sorry. Okay, so it goes around their mouth. All right. Okay. Then you're going to hold, you're going to close the lips tightly around the mouthpiece. Okay. And then what you want to do is you want to press down once on the MDI canister. This is this right here. Okay. And you're going to inhale slowly and deeply through your mouth. Then they're going to hold their breath for at least 10 seconds. And they're going to breathe in, hold that breath in, and exhale, and breathe in again from the spacer. Because when you emit the medicine into the spacer, watch what happens. Ready? Whoops, whoops. Okay, watch. There's like a cloud inside of there. I don't know if you can really see it, but that's all medicine in there. So they're going to be breathing it in, holding it, exhale from their nose, breathe in, hold it, and you can remove it from the mouth. So what's going to happen is that you really want them to breathe in twice, whatever medicine's in here, so that they can get the full dose of that medication, okay? And then they can exhale slowly through pursed lips. If the doctor's ordered 2 doses, you are going to wait 1 to 2 minutes before you do another squirt of the medicine into the spacer. Okay, so there's a little bit of a wait period in between each dose. Okay. After using the inhaler, you want to make sure that they rinse their mouth with water and spit the water out, okay? Because that medicine sits inside the mouth and they can develop thrush. And we don't want that because that's an infection and it hurts and they don't want to eat, okay? And it requires a medication called nystatin to get rid of it, okay? So make sure that they rinse their mouth and spit out the water after they've used an inhaler, okay? You're going to clean the Mdi mouthpiece and spacer if used daily using mild soap and water, okay? Make sure that you put the cap back on the Mdi, okay? And make sure that you put the cap back on the end of the spacer, okay? All right? You're going to store the equipment back wherever it's supposed to be. You're going to remove your gloves and you're going to perform hand hygiene. You're going to document the medication on the MAR and in the client's record. And that's it. That is skill 2.30, administering metered dose inhaler medications.